From vet care to health care. Good afternoon. Hi, I'm Trux Dole. I'm leading Regency's online efforts to help their 2.5 million members make smarter healthcare choices and to avoid the pitfalls that I uncovered while managing my son's 6-year battle with cancer across 5 different health systems and 4 different health plans, including OHSU. So I'm going to talk to you a little bit about today what we're trying to do to help people do those tools, the challenges we faced, and where we're at. So how many of you in the last year have had to use a doctor or hospital? Okay, how many booked a flight online? Would you have booked that flight if you didn't know what the cost was beforehand, or that you could go through Denver instead of Atlanta? Healthcare costs are skyrocketing, yes, but shouldn't we have more of a voice in the value of what we're getting for our money? How do you make a healthcare value decision if you don't know the cost or the quality of what you're getting? Healthcare involves multiple different players. So how do we take complex, confusing data from multiple different sources, present it in a digestible, actionable way, so that that end user can just answer the question, what should I expect when in the course of my care? Putting it another way, how do we best put the patient in the driver's seat, educate them quickly without overwhelming them, all while assimilating multiple pieces of data from entities that really don't want to be transparent? Ever eat spaghetti with a pencil? But it's not just about cost. What do you do when you need to find that doctor? Usually, you just ask the opinion of friends and family, right? That's why patient reviews were the first feature that we brought to market online. We also incorporated third-party quality data because we know that people inherently don't trust health plans. But the quality of care provided can save your life. Did you know that we lose more people to medical errors and hospital infections than to fatal car crashes every year? Hospital costs are confusing, so we developed a tool based on end-user testing that shows you the different levels of treatment, from the treatment to the encounter down to the specific service. A good example of this would be pregnancy. Treatment is the overall pregnancy. The encounter would be the delivery, and that specific service would be that first ultrasound. The trick is, how do you get that patient to understand and care about both their options and their responsibilities? What we did is we said, okay, the overarching objective is to help you make smarter care choices. We show you your out-of-pocket costs, we show you your options, but we also show you the larger costs so that you understand the impact of, since we're all using our funds to pool for those in need. In estimating treatment costs, nobody's addressing what you should expect to pay when and what your options are. We're the only player in the market that's presenting graphically treatment costs and options both in days and dollars as you'd likely incur them. Down to the encounter, the delivery. Our claims analysis shows that on average there's a $1,000 cost savings depending on where you get that service done. Well, how do you educate the patient and get them to work with their doctor in making that smarter care choice? The doctor is the quarterback for your care, but the hospital or the facility is where that variation in cost and quality is. So we present and took a play from Amazon, enable you to compare facilities, but incorporate it into that provider's profile page. And now when you get down to the service level, this is where the treatment tool can actually help you throughout the course of a treatment. Any given day, any given provider, any given service, we can calculate your out-of-pocket costs real time based on where you are in your cost share and all that kind of thing. In the case of an ultrasound, we show you the total cost incorporated into the provider's profile, your out-of-pocket, as well as where it fits into the larger treatment. So build it and they will come, right? Well, how do you build awareness in this overloaded age so that the users know to come and use the tools in the time of need? We chose to use primarily newsletters and then support them with offline and online vehicles to meet users where they're living. Over the past 3 years, we've experimented with a variety of vehicles with varying effect. As you might suspect, integrated marketing campaigns with direct incentives and repetitive messaging have been best at boosting awareness and year-over-year tool usage. In terms of ROI, we've got some good stats to show, particularly compared against non-tool users. Claims analysis is showing tangible reductions in medical use costs, and we're looking at about a 3-year payback. We've also gotten some nice external validation. Lastly, when you look at actual claims costs versus quality outcomes, the real nugget, higher quality doesn't necessarily come at higher cost. So, ask your doctor, if we're going to affect change, ask your doctor what you can do to move that needle to the upper right-hand corner. Thanks for the opportunity to share a glimpse into how we're uniquely tackling the complexities of helping you better manage your care. Your call to action, come use the tools, test them, and tell us how to make them better. Thank you very much.